So hi everybody, thank you for coming. My name is Alejandro Junger, and I'm going to be talking about my experience with Ibogaine. So listen to your heart, follow your heart, open your heart, trust your gut. How many of you have heard this advice before? Everybody. Usually, it is given to us by somebody wise, often when we've lost our way. Yet, for my whole life as a doctor, I have been trained to do exactly the opposite. To trust the medical scientific evidence, to listen to the data, to lead with my thinking brain. It took me getting sick myself and having to look for my own healing outside of the medicine that I've learned in medical school to come to the conclusion that the heart and the gut are not organs chosen randomly by these wise people, but they are thinking, feeling systems that actually each contain a brain of their own. And when these brains, the gut and the heart, fall out of alignment with the brain in our head, we suffer both individually and collectively. I was born in Uruguay in South America at a time when life was healthy by default. There were not even supermarkets. We ate real, fresh food. There was community, connection, simplicity. That's when I went to medical school and I graduated as a doctor and then moved to New York to become a cardiologist. And when I moved, things changed drastically. The pressure, the noise, the isolation, my diet. And by the end of my training, I was really sick. I visited 3 doctors and I was diagnosed with 3 diseases: allergies, irritable bowel syndrome, and depression. And I was given 7 prescription medications. The psychiatrist that I consulted at that time, pointing to my head, said to me, "Your brain is not producing enough serotonin." But I knew that these prescriptions were not going to get to the root of the problem and correct that. They were going to just force a certain chemistry in my body, mainly or only directed to suppress and silence my symptoms. And I realized, sadly, that modern medicine is not geared towards healing. Most doctors are not healers, and I wanted to be both, a doctor and a healer. So I took off after becoming a cardiologist, and I traveled the world looking for what modern medicine had forgotten. In my travels, I spent some time in India in a monastery where I studied meditation, where I was exposed to Ayurvedic medicine doctors, Chinese medicine doctors, naturopaths, chiropractors, hands-on healers, you name it. All modalities that were more concerned about restoring wholeness than about suppressing symptoms. Then I discovered functional medicine. And with functional medicine, my life, personally and as a doctor, completely changed. I learned that the serotonin that I was missing wasn't actually manufactured in this brain, but it was mostly manufactured in the brain in my gut. And that most people in the modern world are walking around with some degree of gut injury, mainly dysbiosis and leaky gut. And that when you help create the conditions for those people to repair their gut, chronic diseases disappeared as if by magic. because 90%, if not more, of the chronic diseases of the modern world originate in the gut. I started helping a lot of people. I wrote books. I designed a gut repair program that I haven't seen one work as well yet, if I may say so. The CLEAN program. My books were translated to more than 20 languages, and I started helping people from all over the world, basically teaching them how to create the conditions for their guts to repair, for their bodies to restore their natural ability to heal themselves. Finally, I had become a healer. Now, around 2010, because my work was known all over the world, I started getting calls from everywhere. And I was called from Italy to help a man that had almost died from several cocaine overdoses. I knew that gut repair was not going to be enough, so I started a deep search to find different solutions for him. One of the things that I learned was that in the 1960s, there was a man called Howard Lotsof who lived in Brooklyn, New York, and he was addicted to heroin, but also loved to experiment with mind-altering substances. One day, a friend of his handed him something that was derived from a plant called Tabernante iboga that comes from West Africa, from Gabon, and it's a very powerful psychedelic plant. He took it, he had a long trip, and when he woke up, the next day, he was free from his addiction. No craving, no withdrawal symptoms. And he was so fascinated that he started telling everybody and trying to bring this to help addicts like him. My search also took me to find a small clinic in Mexico where treatment with Ibogaine that derives from Iboga was being offered to people. And I took this gentleman there, and I saw incredible transformations that could not be explained by biochemistry alone. And this guy got free from his addiction, and until today, he's doing fantastic. A couple of years later, I was helping another hopeless addict, and this one I really loved. So I took him to Mexico, and when he arrived there, he was afraid, and he said, "I'm not doing it if you are not." So I agreed, and I did it myself. At that time, I was having a very good time in my life, and I didn't have any psychedelic experience myself. I thought maybe it didn't work, but I did notice that after the treatment, I lost my cravings for sugar. I'm a sugar addict. So something subtle but yet real had happened to me, and my friend, my patient, got rid of his addiction and did well for many, many years after that. I didn't understand what had happened really yet. After that, life broke me down. Betrayals, an ugly divorce, a near fatal car accident, open heart surgery, periodic separation from my children, and again, like years before, a darkness that descended on me. This time, a depression so deep that gut repair couldn't do anything. I couldn't outthink it, outmeditate, or outbreathe it. Depression so deep that I gave up inside. I decided to end my life. And literally, I was looking for a place to hang myself when I got interrupted by a text message. And this was my daughter, Serafina, 12 years old, texting me from the other side of the world. And the text literally said, "Papa, I know this is going to sound bizarre, but please don't commit suicide." Now, where did she get this information to text me that at that exact time? Was it the brain in her heart? Was it the brain in her gut? I know this brain told her that it was bizarre, but she did it anyways. Whatever the explanation, She saved my life. So I decided to get help. And I called my by then friend who had this clinic in Mexico, because I knew that Ibogaine, first of all, wasn't a hidden thing anymore. I mean, I've heard many people on Joe Rogan. There's a Netflix documentary about it. Tucker Carlson talked about it with the Wolf of Wall Street, who had an incredible experience. So I knew that it had expanded from being used exclusively for addictions to being used very successfully for PTSD and depression as well. His clinic had closed, but he introduced me to a man called Tom Fiegel, who is sitting here right now, who had opened a clinic in Cancun called Beond. I called him. He listened to me like I don't remember being listened to in a long time. And after I was done talking, he said, I think I can help you. You should come to Cancun. A few weeks later, I arrived in Cancun. I had my treatment. And this time again, no psychedelic trip. No life review as many people describe. No insights. Nothing. I was bored out of my mind on the bed connected to a monitor. And I was really disappointed. In fact, I think I got even more depressed than what I came there for. I went to my room. I went to sleep. And the next day, I woke up and it was sunny outside. But it was sunny inside. The storm, the nightmare had completely ended. I couldn't really understand why, but so you can understand, 95% of the negative repetitive thoughts that were tormenting me before had completely vanished, and the 5% that remained had no grip over my feelings. My emotional world had quieted down, not from sedation, but through peace. It was incredible. Now, science has studied Ibogaine, and there's a scientist that advanced these studies sitting right here, and has come to understand that Ibogaine acts in the brain, affecting or acting on many receptors at the same time. NMDA receptors, nicotinic receptors, glutamate receptors, serotonin receptors. It also acts as a inhibitor of serotonin reuptake, right? And opioid receptors. And it is as if you took mushrooms, ketamine, opioids, and antidepressants, just to name a few, at the same time. It's a very generous medicinal plant. In fact, some people say it's a promiscuous medicinal plant because it acts at so many levels. It flirts with so many receptors. On top of that, it boosts the production of certain proteins that help our brain with neuroplasticities. These are BDNF, brain-derived neurotropic factor, glial-derived neurotropic factor, GDNF, and NGF, neurotropic growth factor, that really boost neuroplasticity in our brains. And everybody's talking about these effects as the effects that Ibogaine has in the brain, in the skull. Just like my psychiatrist had talked about it many years before, but I understand it differently. As a cardiologist and a functional medicine doctor, I know that we have 3 brains, not one. And Ibogaine cannot possibly selectively affect the neurons in our skull. It has to affect the neurons in our gut and our heart as well. The neurons in our gut produce 90% of our serotonin and govern intuition. The neurons in our heart govern our rhythms, both electrical, that organize the contraction of the heart and allow the heart to pump, and also our emotional rhythms that allow you to feel compassion and be connected to others. And the brain in our skull is the one that thinks, imagines, calculates, measures, and names whatever is happening around us and inside us. Ibogaine affects all three brains. And what happens is that when these three brains are sick and they fall out of alignment, we live in anxiety, disconnection, and depression, and addictions. When the brain in our skull is sick, we cannot stop thinking. And this is happening to most people around today. For the unlucky ones, it's negative thoughts. For the lucky ones, it's positive thoughts. But the fact remains that we can't stop thinking. The thinking brain has taken over and is thinking all the time. The brain in the heart is disconnected and shut down. The brain in the gut is inflamed and confused. When Ibogaine helps heal and align these three brains, we feel something deeper than health. We feel love. And this is what I've witnessed at Beond over and over again. And then on myself, what I had was not a psychedelic trip, it was a reset of my soul. Now, in the Bwiti tradition, where Iboga comes from, and the use of Iboga comes from, they don't do it to treat PTSD, depression, or addiction. They actually do it for an intention which they talk of as one-heartedness or open-heartedness. And this has been resonating with me since I left Beond. I know that one-heartedness exists. That's what I have with my daughter that prompted her to write that text that's in my life. I actually know that we're all born in that state. And then we lose it as we learn to adapt to a world of closed-hearted adults. So imagine if we used Ibogaine not for crisis interventions, but for expansion. Imagine if we used it for our leaders, our creatives, our innovators, and for anybody that's ready to live from coherence and not from chaos. Imagine if one-heartedness became a desired medical outcome and not just a metaphor. This is what Ibogaine offers. This is the opportunity that it gives us. More than a reset of the brain and an escape from pain, a reunion with self, an alignment of our inner intelligence. Not sedation, but integration. Not a new drug, but a new way of understanding what it means to be alive. Now, this is the vision that I came out from Beond and brought home, and this is the vision that I come here to share with you. Because when we heal the brain in our gut, in our heart, and in our head, we not only heal ourselves, we heal the world. And to finish, before I open to questions, I gotta say this. A lot of people fear Ibogaine because it can cause arrhythmias. Now, what I learned is that when you do it under medical supervision, as I've done it in We Care, in Beond, the risk is actually less than driving in your city to see your cardiologist for a checkup. Right? And the irony is that the medicine that is feared because it touches the heart is actually the one that can teach us to live from it and open it up. That's my talk, and I am happy to answer any questions that you may have. I don't know if they're going to give you a microphone or you're going to shout it out. Is it, does it have a microphone? It has a microphone.
Like this? Okay, weird. Cool. When you were talking about, I forget the gentleman's name in Brooklyn that kind of brought Ibogaine to the United States.
Lotso, Howard Lotso.
Howard Lotso, it had like some sort of like profound impact on that area, so much that it was like a threat to pharmaceuticals. And since it's kind of been, I don't know if it's been reinstated in the United States, but the clinics are in Mexico and Canada. They're not available here. Is that still a thing? And if so, do you see like the United States being, receptive to Ibogaine clinics in the future?
There's a lot of things happening, but I'm not going to make that answer honor, but I'm going to invite Tom to come up and help me with this. Tom, come. So he knows way more about that than me. And you hear you.
I think the question was, good morning, by the way, my name is Tom Fiegel. I think the question was related to policy change in the United States to allow more science, research, and access to Ibogaine and treatments like that. And we all know there are changes underway. There's been initiatives for many years. Dr. Deborah Mash, who led the first clinical trial on Ibogaine, is sitting here, still at it after decades. And you are one of the giants on whose shoulders we stand at Beond. But there's also initiatives in Texas, and $50 million has been legally allocated for research into Ibogaine. But the truth of the matter is that we don't have access to this technology in the United States. And while there will be many people who will argue today about why is that, who is responsible for suppressing this type of technology or the research into this type of technology, I think most of our attention should be focused on what are we going to do about it? What can we know? What can we learn wherever we can learn it today so that we can inform those policy makers and provide more insights based on real stories, sometimes by experts themselves, on the performance of this technology. Changes underway for sure.
So I can answer questions about the experience itself and the biology, this physiology of it, right? But Tom will stay here with me to help me out. Yes.
Thank you. Thank you. So I'm just curious. I know the tribes that discovered it in Africa, they microdose it basically daily. They have no words for anxiety or depression. How is Ibogaine how is it different than the pure plant Iboga? And how is it administered? Is it through IV? How does that work?
So Iboga, the plant Tabernanta Iboga, the root bark of it is crushed into a powder, and that's what the Bwiti take, and they use it for their religious experiences. It's a sacrament to coming of age, and also for some medicinal purposes, but basically to communicate with God. They call it the plant that knows it all. Right now, they take the whole thing, and the whole thing is a group of alkaloids mainly. There's other compounds, right? And they have an entourage effect. They act in many different ways. Now, in the West, we always try to simplify things in a way and discover the active ingredient. So Ibogaine, which is one of the alkaloids, is extracted. And what that allows is a more standardized use. We know the dose per kilogram. We know how often to give it, and we can give it easily in capsules. It's a powder that you take in capsules, right? And it's about 70 to 100 milligrams per kilogram of body weight. So, for example, for some people it lasts 12 hours. For some people it lasts even longer, the trip. And the trip is divided in different parts. One part is the vision, and people talk about it as a life review, kind of what you hear about that with people that have a near-death experience. They see their life in 3D. They see the moments that people hurt them and that they hurt people, but they see it from a compassionate point of view. They see their trauma actually dissolve in front of them, right? After that comes a period of insight, and you start understanding things and putting things together. I had none of that, because when you take Ibogaine, first it's absorbed into your blood, and the Ibogaine itself is the one that has the oniric effect or the psychedelic visual effect, right? Now that is then converted by an enzyme called CYPD26 or CYP2D6 into noribogaine. And the noribogaine is the one that acts at all these different receptors that I was talking about, and that causes the neuroplasticity and the addiction interruption and the depression dissolution, right? Now, I, for example, immediately called a friend of mine who has my genetic code and asked him what the hell is going on. And he said, you have too much of that enzyme and you're a really ultra fast metabolizer. Yes. Yeah, I'm one of the few, right? So I didn't have the complete experience. I'm actually I discuss this a lot with Tom. I'm actually very envious of the people that do have it, because on top of having the effect of depression disappearing, they actually understand what happened. Some people, Mark Hyman was talking about it yesterday and how he saw himself as a kid and after an episode of bullying, or this is what I heard, I wasn't there, but he understood and was able to close that loop, right? I didn't understand anything, but I'm very grateful for the results anyways, right? So, yeah.
Hi. Oh. So I guess maybe you won't be able to answer my question. So I was at Dr. Hyman's session yesterday, and I guess I'm a little late to the Ibogaine party. This is the first time that
You're what?
I'm late to the Ibogaine party. The expansion. I'm very curious, in comparison to other psychedelics, what I heard from Dr. Hyman's experience yesterday was that it had a profound change. Almost, I don't know if it was immediate or not, but do you think the effects are, all the different brains are expanded, or they're connected and they're resonating or working in coherence, and that's why this medicine is different than other psychedelics in the change that it evokes in the system? So you don't, with other psychedelics, you might be able to feel it, but the brain might be a little bit late to the processing for the long-lasting changes. How is this? This seems to be
I got the question. It's a really good question. And I happen to be kind of experienced in taking many, many other psychedelics, from mushrooms to ayahuasca, peyote, huachuma, San Pedro. I've tried them all, right, in the last 20 years. And this one is very, very different. And I'm going to ask Tom also to help me with this answer, right? But in my understanding, all the other psychedelics that I tried gave me visuals and I was able to talk to the dead and I got messages, right? But then I was left with that information to do whatever I could. With Ibogaine, I got no information, but the transformation is undeniable. I still cannot believe it. I pinch myself and I actually go into the thoughts that caused me the desire to kill myself, and I bring them on. And then just like I couldn't get out of them before, I cannot hold them now. It's like when I start thinking about them, they do nothing in here. And then I end up thinking about this talk or the projects that I have in my mind. So in that way, they're very, very different. But can you add to this?
Yes, thank you. So as Dr. Junger pointed out, there's really at least two core sets of functions related to how we think Ibogaine is working. The first one is the neurobiological effect, which you can't see happen. It's kind of like sit-ups. You keep looking in the mirror. After you do them, you don't notice much change right away. And the effects on the thinking brain, and now what Dr. Junger is describing as the second brain is a gush, and now the third brain in the heart, happen whether or not you have any visual effects, it seems. But for many people, having that, what can be called a life review or a psycho-spiritual experience of observing but not re-experiencing painful past memories, can cause, I think, the compounding effect of the neurobiological changes, so that there's more meaning making that is immediately accessible, as opposed to anticipatory, hoping that, wow, if the sun is brighter and I don't want to, thank God you didn't, hang myself, then I'm going to have a vision of how I move into this next chapter or phase of my life. I think you said you were envious that perhaps it would be more meaningful more quickly if those had been occurred coinciding. Usually there is a psycho-spiritual effect, and thank you. And unlike other psychedelics, many of them are described as making us feel like we go out, that we have observable changes in reality, but they're outside of ourselves. You might stare very closely at a flower or a rock and think, wow, I've never really seen that rock that way. And that could be very creative. It could be recreational. However, Ibogaine is usually internal. Everything that is seen or visualized or symbolized is sourced from a sense of meaning in memory. So it's almost like you had a very, very long autobiographical dream. Out of sequence, many events of your life presented, but you knew what they meant. You knew that bicycle was the bicycle. We don't know without talking with you, well, was it the one you learned to ride on, or one that got stolen, or the one you never got on your birthday? But there's some meaning derived from this symbol related to the memory of the past, which informs your identity. I am what happened to me, as distinct from I am what I'm becoming based on my new perspective on what happened to me. Ibogaine is deeply introspective. Other psychedelics oftentimes feel like we have to go out to observe a shift in reality and then interpret it. I hope that helps you. Any more questions?
We're going to go back here first.
Can you elaborate on what you mean by one-heartedness? Like, what is that like to you? And for what do you get?
That's a really good question. Listen, I'm no expert on this other than I'm a human being, and I experienced it myself. I mean, how did my daughter know what was happening to me from the other side of the world, right? And if we weren't connected at that level, right? So this is as much as I can tell you about that. Otherwise, I would be leaving my hat as a doctor and talking as a priest, which I am not, right? But it's a really good question.
Question?
What does the protocol at Beond, the experience itself, how long are you there at the clinic? Walk us through, like what we have to commit to time-wise.
So really good question. And this is what I know. And then, Tom, if you have to add anything, let me know. Depending on why you come and what your state is before you come, the plan is made for you. For example, if you're an addict and you're still using, then you're going to be asked to drop the drugs, whether it's outside and then come in, or whether it's in Beond itself. There's a doctor that I met here that actually works with you, helping people get off their medications. There she is. Yeah. So if you come in and you haven't dropped the drugs, you will stay a little longer until you do and you're ready, because you have to prepare the receptors. Otherwise, they're inundated with the drug itself. Some people are also on antidepressants, and they need to come out of them before they get their treatment. In my case, because of my open heart surgery, I was and I am on beta blockers. Now, beta blockers slow the heart. Ibogaine slows the heart too. So both of them together put you at a higher risk of the cardiac risk, right? For which you have to be on a monitor and with an intravenous line, so they can give you magnesium or atropine depending on where you go, and correct whatever is going wrong in a minute, right? But I had to be there for a few days to get off of the beta blockers, which your body reacts to by increasing heart rate and blood pressure. So they put me on different medication to compensate for that time. So I was there for 4 days or 5 days. Then you go in and you get either a flood dose, which is a big dose, which usually is the dose that is associated with the psychedelic experience, or for people that are at a higher risk or are very fearful or anxious, they give them fractionated doses, right? And then a couple of days later, I got my supplemental dose, which is a smaller dose, just to make sure that there's enough ibogaine and then nor-ibogaine to really act on all these receptors and boost these proteins for neuroplasticity, right? And then I left. So it could be anything from 1 week to 3 weeks, 4 weeks.
It's a great question. So, as Dr. Junger described, it is contingent upon your objectives and your condition. Usually no shorter than 1 week. Usually not longer than 14 days, unless there's some pre-existing condition or dependency that would need to be more carefully understood and addressed. But over thousands of treatments, we've gotten better and better at tuning those protocols for specific patient populations. Those protocols, just like we would assume in open heart surgery, you don't go into the hospital, get the procedure, and leave. That there's a fair amount of preparation that usually should begin prior to getting to the hospital. And so the protocol you're asking about includes remote preparation with therapeutic coachings, with evaluations. Sometimes those are very detailed, related to your physiological or psychiatric condition. That preparation continues beginning when you are actually admitted into Beond, and it's changed, it's more focused about the specific experience or expectations related to that. And it continues almost in the rehab phase after the Ibogaine experience for weeks. So of course we do that as much as we can on site with direct one-on-one therapeutic support, one-to-many workshop type of environments, using an app that we've developed to allow someone to continue that engagement and share with other people who have gone through that, as well as online group types of alumni programs. The rehab or the integration, or what we call activation, needs to be thought of at the very beginning in the preparation. So those protocols include the experiential aspects of this particular medicine and the specific diagnostic assessments to make sure that we're doing things carefully and accurately.
Oh my goodness. Hi. So I just wanted some clarification about the timeline of things. I work with ketamine, so I'm just really fascinated by your lack of sort of narrative or epiphany and the change. But what I was wondering is, did you try other psychedelics before Ibogaine, or Ibogaine was your entry point and then you tried other psychedelics?
I tried them all.
Before Ibogaine? or after Ibogaine?
Well, I tried Ibogaine for the first time in 2010.
Yes.
So, but at that time, it was just used for addictions, or mostly used for addictions. And I was actually at a really good stage in my life. So I didn't really need it. I did it because I really loved this patient. And I didn't want, we had gone to Mexico, we had set up the whole thing. And he said, I'm not doing it if you're not doing it. So I did it. And the only thing I noticed was, because I didn't have and I still a fast metabolizer then, I didn't have this psychedelic experience. The only thing is when I got back home and I wanted no sugar, which was very weird for me.
Yes.
But I did no work after that. I did not do anything after that to maintain that. So the addiction came back, Ibogaine is an addictive disorder. Now I did try every psychedelic that you can imagine, but I didn't do them. Actually, the first time I did ayahuasca, I did it for a crisis that I was going through. The other times, it was just, exploration, right? Expansion, or whatever you want to call it, right?
So the exploration or the expansion didn't lead to behavioral change for you.
Well, yes, with every psychedelic, I had behavioral changes, and I had insights, and I had all kinds of revelations, and my life actually improved. But I knew instinctively, my gut brain told me that this time it was so deep, and I was really from ending everything. I knew that all the other psychedelics were not going to work. And even though I thought that Ibogaine did not affect me,
yes,
because the first time did nothing for me except the sugar, which I kind of didn't pay much attention to, something said to me, this is what you need to do.
Yes.
And then I spoke to Tom. We had hours and hours on the phone. The poor guy, I don't know how he had time for me. But that's when I said, this is what I have to do.
Thank you. And I guess, Tom, I have a question, because I've seen this cumulative effect. Like, I've seen patients do several courses of ketamine, not really getting there, and they do one psilocybin at home, and it's like everything comes together.
Yes.
So I guess I'm just wondering if you can comment on that.
Hopefully everything comes together. I think, very briefly, there is a pattern that we're seeing, which is Ibogaine represents something different in terms of treatment protocol. It isn't something that is repeated many, many times for continuous relief from these types of symptoms. Now, ketamine, psilocybin, other types of psychedelics tend to assume that you're going to go to a therapist's office. It's not the only way to do it, of course, and sit with the therapist over many weeks or continuous sessions. And as you've said, hopefully everything comes together. And oftentimes it does. And there's a very, very important role for that technology to be used for acute relief, so that there's stabilization is oftentimes the goal. If someone's in acute crisis, ketamine, for example, can help quickly, but it doesn't seem to last without repeating it or with the presence of a therapist. Ibogaine is very unique. There's no therapist during the treatment. Usually they can be in the what's called the second phase, where the visual experience is less intense and it's more contemplative. And there can be some interpretive dialogue and support of the meaning making that happens, but it's usually not required. This is seems to be a very, very individualized experience. And of course, we give voice recorders and notebooks and so on, and people can capture themes and ideas that are coming up. Dr. Hyman said he dictated 5,000 words after his experience. And I think that the presence of the therapeutic support is crucial in the repeated types of treatments. You also don't go anywhere while you're on Ibogaine. Nobody shows up in the morning, takes Ibogaine, and drives home that evening. You're staying because we're monitoring both the preparation and the effects and tolerance of the medication so that we can then compound those effects with the therapeutic support when you're not experiencing the effects of the medicine. And that seems to be crucial to optimizing the performance of the medicine.
So I have an idea for you who asked me about one-heartedness, right? I wasn't satisfied with the answer I gave you, but I have this idea. At Beond, when a guest, a patient, or however you want to call it, leaves, they stand at the door and they look at the staff and everybody else that's getting treatment, and they talk about their experience, right? So I'm gonna put the microphone to let you listen what this lady said on her goodbye day at Beond. This is the wife of a Navy SEAL that got healed from severe PTSD. And then the guy comes home, and after years of being depressed, she felt inadequate and she came to Beond, right? And this is what she said.
Confused and filled with anxiety. Looking back and rereading some of my journal entries made me realize how I've changed since walking through the doors. In fact, I don't even recognize myself anymore. I'm no longer drowning underwater, but instead I'm swimming laps on top. I'm laughing again, smiling again. I have confidence. And for the very first time in my life, I love myself, which is huge. I know what pure love and peace and happiness feels like, and I know what God's love feels like. Beond saved my husband's life, but Beond gave me my life back. For that, I'm incredibly grateful. Thank you to the beautiful staff.
So I don't know if that adds to your curiosity, but I mean, nothing more explanatory than listening to somebody's experience. Yes.
If I want to know if you had any experience or could speak to the efficacy or the response that people have through microdosing rather than a full-blown experience, and how that affects people and what you've seen on that level.
I think this is the guy's answer.
So, sorry, you're asking about microdosing or really the range of dosing. So microdosing with Ibogaine is especially challenging because, number one, Ibogaine is a Schedule 1 in the United States. It is more illegal than fentanyl or cocaine, and so, which are drugs that usually people interpret as stay away from because they're bad for you. So possession of, manufacturing of, distribution of Ibogaine in the United States is illegal and is a felony. So microdosing would mean, in order to do it legally, you would have to go to a region of the world. I live and work in Mexico, where you could access that Ibogaine and presumably consume it there in order to avoid being accused of a crime or committing a crime every time you wanted to microdose. Very unworkable for most people. However, there's a difference between microdosing and what we call fractional dosing. And fractional dosing is a consistent use of a much larger dose, still smaller than what we call primary dose, the largest clinically safe dose of Ibogaine. Fractional dose is a fraction of that, and we use it consistently over a period of days. What happens is the cumulative effects of the noribogaine is what's changing the brain chemistry. And Ibogaine has a very long half-life. So as those fractional doses are conducted, it accumulates in the tissue, in the liver, and the noribogaine in the brain. Now we know in the gut and in the heart, perhaps. So the first one may not have a profound psychoactive or psychospiritual effect. The second one seems to have more. The third one seems to have even more than that. And so cumulatively, the individual experiencing fractionals ends up with the same or more Ibogaine over an extended period of time without the intensity or the need for recovery in the same way. They can get to work more quickly if they don't do the largest dose. Now, there are some patient populations for whom that is crucial, particularly heavy doses of short-acting opioids. We need a larger dose to shift that brain chemistry. Otherwise, they're sort of almost without withdrawals and they suffer. And we don't want that.
And one more thing, be careful, because there's a ton of things popping up that you can buy microdosing here and there. And the thing is this, unless you know what your electrocardiogram looks like, what your QT interval looks like, it may be risky. And then some people may say, well, I want to have a little bit of a psychedelic experience and take a bunch and have an arrhythmia without medical supervision. So it's a touchy, risky thing to do, to just microdose, especially if you don't know where you're getting the product from.
Question over here.
Yeah, the risk is the prolonged QT and the possibility of something called torsades, which is a ventricular arrhythmia that basically gives you a cardiac arrest. Well, that's what when I say that Ibogaine acts on all three brains, well, at least we know for sure that it's acting on the potassium pumps inside the membranes of those neurons, right? So we know one physiologic effect of Ibogaine in the brain, in the heart, and that one, the alteration of the potassium pump and the membrane difference of voltage between the inside and the outside, that prolongs the QT, so slows down the repolarization of the heart, which makes it dangerous for torsades, the point. But when that happens, immediately you have an IV line. When you're medically supervised, for example, what they do at Beond, and you give them intravenous magnesium or atropine, and you correct that within a second.
Question over here.
Thank you for everything that you shared, and for all of the help and support that you're offering people that need this. I was wondering about the contraindications for taking Ibogaine, if there's people that should not be taking Ibogaine.
Probably. So part of our protocol is very in-depth screening, both for pre-existing psychiatric conditions that could cause an individual, while under the influence of a psychedelic, to feel a trauma, to experience a psychotic break. And those folks should be very, very carefully supported to find something else other than Ibogaine, because it's a very deep, very long journey while it's happening. And so we believe that if that has been exhibited in the past, it's very important to try to avoid it again and to screen very carefully for that. And the fractional doses actually could improve upon the decrease of the likelihood of that. But we still are extremely cautious about that, because there are other psychedelics that have similar benefits on a psychospiritual level that would be able to be delivered for a much shorter duration. The other pre-existing conditions are related to cardiac diagnosis in the past. Now, here's a cardiologist who had open heart surgery before considering the need for Ibogaine, and ended up being screened carefully, tested carefully, and determined that he was a qualified candidate for this. One of the things that I feel a great pride of related to Beond is, of the 13 doctors that work at Beond full time, that they are interested in understanding what is the condition, what is the circumstance in which Ibogaine could be used safely, as opposed to just ruling everybody out and saying, well, they've somewhere down the line had some pre-existing diagnosis or prescription, and they're ruled out because we know it works, and we need to, wherever we can, try to include people while minimizing risks of an adverse event or a severe adverse event. Does that answer your question? Yeah. Dr. Hyman, come up here, please.
Yeah, so I just want to answer that question because I had 2 heart surgeries. I had atrial fibrillation. I was really worried, but I had an echocardiogram. I had a Holter monitor before. They made sure I got fully evaluated. I talked to many physicians who were there, electrophysiologists that they work with, and I ended up having a full flood dose and was perfectly fine.
Thank you, Mark. Good to see you. I think that was the last question, if I'm not mistaken. Well, thank you all very much. Wonderful to be with you. Thanks for your time. See you later. Thank you, Doc.